All right, started your timer, and here is your question. Right, so if you have read and understood, considering the surgical anatomy patient, kindly tell me what are you looking at, if you can identify the structures.
Ma'am, this image shows the image A shows the medial portion of the left foot, and
Yes.
the image B shows the lateral portion of the left foot.
All right, can you please identify 9 over here?
Ma'am, that is the lateral tubercle of the talus bone.
Very good. Okay, can you please identify 21 here? Picture A.
That is the tubercle on the cuboid bone. Sorry, tubercle of the navicular bone.
Navicular. Okay.
Yes, sorry.
What type of bone is navicular bone?
Navicular is a sesamoid bone.
Very good. In which tendon?
Tendon is, I guess, tibialis anterior. No, it's not.
What is another characteristic of navicular bone? Other
Ma'am,
than
it is
being a, yes.
a navicular bone can undergo a vascular necrosis, that is also called a Scholl's disease,
Avascular necrosis, yes.
and that can also be an accessory navicular bone,
Yes.
which can cause pain.
And it is more common in males. That's why you should know. And it's frequently self-limiting in unilateral. That's another good. Okay, very good. Can you please identify 19 in picture B?
And that is the tarsal sinus.
Yes. What's significance of this?
Tarsal sinus contains the adipose tissue and nerve endings. Therefore, it is a mechanicoreceptor of the ankle joint. Repetitive injuries can cause tarsal sinus syndrome.
Okay, can you please tell me what are the stabilizing factors, how a person walks? If you can comment on the stance and go pattern, like walking and stance, in which.
Ma'am, I will get back to you for this.
All right,
later.
can you tell me what are the types of foot arches?
There are 3 arches: the
Yes.
medial longitudinal arch, and the lateral arch, and the transverse arch.
Okay, can you please tell me how the medial longitudinal arch is formed?
The bones of the medial longitudinal arch are the calcaneum, talus, navicular, 3 cuneiform bones, and the medial 3 metatarsal. Muscles included are the flexor hallucis longus, digitorum longus, and brevis, and tibialis anterior and posterior.
Yes.
And ligaments are interosseous and spring ligaments.
Right. Can you please tell me about the deltoid ligaments anatomy?
Yes, ma'am. Deltoid ligament is present over the medial aspect of the ankle joint.
Yes.
It is formed by the tibionavicular, tibiocalcaneal, the anterior talotibial, and the posterior talotibial ligaments. Ma'am.
Yes.
And it is.
Yes.
Yes, ma'am.
What are the what is attached to the posterior talotibial ligament? Where is it attached? Would you be able to identify it here in any of these C, D, or E image?
Posterior talotibial. Yes, ma'am. It is the 19, number 19 on the image E.
Okay, we'll get back to that later. Okay, can you please tell me, yes, can you please tell me what are the muscles which are like muscles of walking and climbing stairs on in the human being responsible?
While walking, the muscles of the anterior compartment of the leg and the posterior compartment are used.
Okay. Can you tell
Um,
me about the mid tarsal joint of Chopard? What is it?
yes, ma'am. It is the compound joint made up of the talonavicular part of the talocalcaneonavicular joint and the calcaneocuboid joint. Ma'am.
Okay, can you identify these structures in picture C? Number 6,
And that is the deltoid ligament.
26,
And that is the tuberosity of the navicular bone.
18.
Calcaneonavicular ligament.
Okay, and in D, if you can identify 1 and 3.
One is the that is the medial anterior talofibular, and three is the calcaneofibular ligament.
Right. If you can tell me this 22 is pointing at what?
And that is pointing at the tarsal sinus.
All right. If you can identify 3 and 19.
And 3 is the calcaneofibular ligament, and 19 is again the posterior talofibular ligament.
25, please.
25. I
Okay,
don't
can you
know.
tell me the structures passing behind the medial malleolus?
The posterior tibial vessels, the flexor digitorum longus muscle, the posterior tibial nerve, and the flexor hallucis longus muscle.
Can you please tell me what are the bones which form the ankle joint?
The trochlear surface of the talus and the lower end of radius, lower end of tibia and fibula.
Yes. What type of joint is ankle joint?
Synovial hinge joint.
Yes. This ankle joint is most stable in which position and why?
It is more stable in dorsiflexion because the more wider anterior part of the talus is in articulation in dorsiflexion, while as in plantarflexion, the posterior part, which is narrower, is in articulation. Therefore, more space is left anteriorly for movement.
Okay, can you, all right, would you be able to identify Achilles tendon? Where does it insert? In any of these images? Can you or
Ma'am,
not?
number 23 in the image E,
Okay, good. Can
posterior
you,
part of the.
yes, can you tell me what muscle makes this up, this Achilles tendon?
Achilles tendon is a combined tendon of three muscles:
Yes,
soleus, gastrocnemius, and plantaris muscle.
okay, good. Can you please also tell me what type of joint is subtalar joint?
That is a synovial ball and socket joint.
Yes, okay. What are the movements which are present at subtalar joint?
Inversion and eversion
Eversion,
of
very good.
the foot.
So which muscles are responsible for these two movements?
For inversion of foot, the tibialis anterior and posterior with some help from extensor and flexor hallucis longus muscle,
Yes.
and eversion is peroneus longus and brevis.
Okay, can you please identify number 6 in this image?
And that is the extensor digitorum brevis muscle.
Okay, can you please also tell me how this extensor hallucis longus muscle inserts and where?
It extends into the distal phalanx of the picto.
Okay. Yes, how? Where does it insert?
Distal phalanx of great big toe.
Distal phalanx, okay. All right, can you please tell me how the dorsal venous arch is formed? Can you identify it here in the image?
Dorsal venous artery.
Yes.
No.
Okay, where would you palpate arteria dorsalis pedis? If you can tell me the surface marking.
So, it is palpated external to the lateral to the external hallucis longus tendon between the first and second metatarsal bone.
Okay, what is the dermatome of ankle reflex?
S1.
Okay, how is it tested?
The patient is asked to put his leg pointing laterally,
Yes.
and the foot is flexed and relaxed, and the hammer is tapped on the Achilles tendon, and the movement is to be looked at on the calf muscles.
Good. Thank you. Where is your question?